My name is Ayotunde Dokun. I'm the chair of the diabetes section of NMA, and I recently became division director at the University of Iowa, so my affiliation recently changed. I want to thank you again for joining us for this year's endocrine diabetes section. We have a wonderful list of speakers, as we've been trying to do every year. And you would see that we have a mix from the legends to a medical student. And that's intentional, okay? Because the internal medicine section has been very intentional about trying to include early career folks in this section because they are the future of the section. So I'm going to start by just introducing you to something that I think it's very important that we are aware of, for those who may not be aware of it, and it's the National Clinical Care Commission. I want everybody in this room to be aware that this commission exists and has ongoing work that I think is very relevant to our mission as a section and our mission as a society. And I want us to please try to spread the message about what the NCC, National Clinical Care Commission, is doing, and more importantly, I want us to get involved in it. So this commission was established in 2017 by essentially a law that was passed in Congress. And the purpose of it was to evaluate and make recommendations regarding improvements to the coordination and leveraging of programs within the department and other federal agencies related to awareness and clinical care for at least one but not more than two complex metabolic or autoimmune diseases. That is to say, the purpose of this commission is to look at programs related to type 1 and type 2 diabetes, okay? Part of the focus will include looking at federal programs of the Department of Health and Human Services that focus on preventing and reducing the incidence of diabetes, current activities and gaps in federal efforts to support clinicians in providing integrated high-quality care to individuals with diseases and complications, and focusing on improvement in and improved coordination of federal education and awareness activities. I'm going to try to move quickly because of our time. To summarize, the whole purpose of this federal commission is to look at existing federal programs that relate to people who have type 1 and type 2 diabetes, the development of the disease, and its complications. The task, the committee consists of 23 voting members, 12 non-federal members, and 11 federal members. This is publicly, if you Google National Clinical Care Commission, you can pull up the names of the people that are involved in this. I've been fortunate enough to be one of the non-federal members that's serving on this committee. One of the key reasons why I wanted us to be aware of this is that part of what this commission does is public comments. And we've had a few meetings now, and you can see that advocacy groups are coming to talk to the this commission. And I think NMA needs to be aware of, NMA and NMA physicians needs to be aware of what this commission is doing, and we need to make sure that our voices are heard. Anybody who wants to address the commission is allowed to address the commission. You just need to email ahead of time of the next meeting, make them aware that you want to address the commission, and they will give you the time. Okay. I think it's the last time such a commission was put together was in 1976, and the work that commission did transformed how we practice, how we care for people with type 1 and type 2 diabetes today. One of the key things, some of the programs that came out of that are things like the DPP and some of the landmark studies that we now appreciate and have guided how we care for individuals with diabetes. But the key thing I wanted to make sure we're aware of is this committee's meeting. You can get involved. Please get involved and let your voices be heard about how you feel, the direction of what direction this committee should go in, and the kind of work that, the kind of areas that you feel like they should focus on in terms of addressing the issues related to type 1 and type 2 diabetes. This is the timeline. Year 1 is information gathering. Year 2 is analysis of the information that has been gathered. And year 3 is review of the findings and development of recommendations. The recommendations would then go to the Secretary of Health and Human Services and the Congress. There's actually a charge that says within 90 days of the completion of the work of the committee, this recommendation has to be submitted. That's all I have. I hope that we will get involved in that. All right. Thank you.